Welcome to Zen Zone Health. Today we're diving into a topic that's close to my heart, the often overlooked signs and symptoms of multiple sclerosis, or MS. We're going to cover 9 surprising signs that you might not typically associate with this complex condition. Make sure to subscribe to our channel for more health insights. You know that feeling when you step off a roller coaster and the world keeps spinning? That's vertigo, and for some, it can be a sign of MS. You see, Mississippi can cause lesions to form on the brain, and if those lesions impact the areas responsible for balance, vertigo can be the result. Imagine feeling dizzy and off balance, like the room is constantly in motion. It can be incredibly disorienting and even debilitating. Now, if it's just a temporary bout, motion sickness medication might do the trick, but when it's a chronic issue caused by MS, we need to explore specialized medications that target the underlying cause. Imagine your brain trying to tell your mouth what to say, but the message gets scrambled along the way. That's what it can be like for MS patients experiencing speech disorders. We're talking about slurring words, stuttering, and even losing the volume in your voice, and it all comes down to those pesky brain lesions again. They disrupt the brain's ability to communicate effectively with the muscles responsible for speech. The frustrating thing is, these speech difficulties tend to pop up in the more advanced stages of MS, which is why early diagnosis and treatment are so crucial. Swallowing might seem like the simplest thing in the world, right? But when MS enters the picture, even this basic function can become a struggle. See, the nerves that control the muscles in your mouth and throat can be damaged by MS, leading to difficulty swallowing, also known as dysphagia. This is a serious symptom, often showing up in the later stages of the disease. But here's the thing. There are ways to manage it, exercises to strengthen those swallowing muscles, modifications to your diet, and in some cases, even medication can help improve swallowing function and quality of life. Chapter 4. Itching. When your skin sends mixed signals. We all get itchy sometimes, right? But imagine an itch you just can't scratch, with no visible rash or irritation. That's the reality for some MS patients. The culprit? You guessed it. Nerve damage. When your nerves are misfiring, they can send those itchy signals to your brain, even when there's nothing physically irritating your skin. And here's the kicker. Your regular over-the-counter anti-itch creams won't do a thing. We're talking about treatments like anti-seizure medications, antidepressants, and even cognitive behavioral therapy to help manage those phantom itches. Chapter 5. Hearing problems, more than just a ringing in your ears. While not as common as some other MS symptoms, hearing loss can be a real concern for some individuals. Imagine losing the ability to clearly hear the voices of your loved ones or the music you enjoy. It's all about nerve damage, folks. Those vital nerves responsible for transmitting sound signals to your brain can be affected by MS, leading to hearing loss. The good news is that in many cases, this hearing loss is temporary and tends to resolve on its own over time. But it's still crucial to get it checked out by a doctor to rule out any other potential causes. Chapter 6. Tremors. When your body has a mind of its own. Picture this. You're trying to button your shirt or sip your coffee, but your hand won't stop shaking. That's the reality of tremors, a common symptom of MS. These involuntary muscle movements can be incredibly frustrating, making even the simplest tasks a challenge. And while physical therapy can help improve coordination and muscle control, there's currently no magic pill to make tremors disappear entirely. Headache and migraine. More than just a pain in the head. We've all experienced headaches, but for people with MS, they can be a recurring and debilitating symptom. And we're not just talking about your average tension headache. Migraines, with their intense throbbing pain, nausea, and sensitivity to light and sound, are also recognized as potential MS symptoms. Researchers believe that lesions in certain areas of the brain, particularly the brainstem and cortex, play a role in triggering these headaches in MS patients. Chapter 8. Breathing problems. When taking a deep breath becomes a struggle. Breathing is something we often take for granted, but for MS patients, it can become a daily challenge. When MS attacks the nerves that control your chest muscles, it can weaken those muscles, making it difficult to draw in a full, deep breath. This shortness of breath can be incredibly frightening, and, if left unmanaged, can lead to fatigue and even respiratory complications. That's why it's so important to talk to your doctor if you're experiencing any breathing difficulties. Chapter 9. Loss of taste and smell. When food loses its flavor. Imagine sitting down to a delicious meal, only to find that everything tastes bland and unappetizing. That's the reality for some MS patients who experience a loss of taste and smell. It might seem like a minor inconvenience, but it can have a big impact on your quality of life. Think about it. Food is often a source of pleasure and social connection. When those senses are dulled, it can take away from the enjoyment of meals and even lead to decreased appetite and nutritional deficiencies. Outrow, stay informed, stay healthy. Thanks for joining me today on Zen Zone Health. We've covered a lot of ground exploring 9 surprising signs of MS. Remember, knowledge is power when it comes to your health. If you're experiencing any of these symptoms, don't hesitate to reach out to your doctor. Early diagnosis and treatment are key to managing MS and maintaining a good quality of life. Don't forget to like, comment, and subscribe for more health tips and information. Stay healthy and see you next time.